Welcome everybody. It's Nigel Giam here, the lead GP training program director for the St Mary's Schemes. We've got a bit of a festive theme going on here, and I'm very happy to have Joe join us today to talk about his recent SCA success. Joe, well done. Really, really happy for you. You must be very relieved.
Yeah, I'm still so relieved. Like it was, yeah, getting the result was such a horrible feeling before, and then when I saw
Yeah.
that green tick on the screen, yeah, just a massive wave of like, thank goodness.
Oh, and I was so glad to get your text as well. So thank you so much. Tell us a little bit about yourself and your journey into GP before we kind of get into the SCA strategy.
Yeah, so I did foundation training in Birmingham. Then I did a couple of years of just locuming on respiratory, bit of elderly care, bit of peds, and I couldn't do my GP job as an F2 doctor because of COVID. So I
Ah,
stayed
yes.
on a pediatrics job.
Yeah.
So I didn't really get to experience it. But I'd always thought about doing GP and thought it seemed like the best fit for me in
Yeah.
terms of bit of variety, good for sort of lifestyle as well.
Yeah.
Uh,
Yeah.
and making it what you want. And so I started GP training back in a couple of years ago and
Yeah.
in the Black Country Deanery. So
Excellent. And now, obviously, success. And we had you on the masterclass. We saw that you were playing to your strengths, which is that you were very good with patients and our simulators. But I suppose what I wanted to break down today was your strategy for each of the three domains. You did really well. You scored 94, which is a very, very high score. Obviously, we had our masterclass. We had a couple of one-to-one sessions, which were very fun.
mm,
And which I really enjoyed. A bit of tough love dispensed, but we got the result, which was good.
yeah,
Can you tell the audience a little bit about what you think the main themes are in terms of kind of data gathering, how to maximize marks there?
I think one of the things you taught us on the masterclass class and moving forward was about priming and sort of dialing in quickly onto what you sort of be expected, what
Mm.
in the case because it just helps you get in that sort of mindset. And obviously you might have an idea what's going to come up and then it might be different, but often it's sort of you can sort of match it, and it just gives you a little bit of confidence going into it. So I think that was a good starting point for the data gathering.
Yeah, absolutely. I think we underestimate actually the power of priming and why we're giving the information that we're given. And I think one of the things that we talk about is why. It's about being kind of curious,
Mhm. Yeah.
making sure that we're not parking queues, following the narrative. I mean, I suppose for a lot of people out there, they may see it as a kind of an OSCE and a tick box exercise in
Mm.
terms of data gathering. What are your thoughts about that?
Yeah, I think when I went into it, I was very much trying to make sure I asked all the questions because I thought I need to show that I'm thinking about every single possible thing and I'm not missing a single question about the respiratory system or
Mm,
whatever. Then I realized like practicing and doing the course that it's not about that. You can get all the information you need without asking every single possible symptom question, and but it's much more important that you look at the cues and because that you'll get most information from that if you're listening. You've got to try to step back and not lead with the questioning and just
that's
listen to what
right.
they say, which is it's quite hard to do, but
Yeah.
can do it. It really helps.
That's such an interesting thing, isn't it? Because we tend to ask quite leading questions when we're under pressure,
Yeah.
and they're quite symptom driven. But the cue is the king queen of the consultation. Did you find that the simulators tried to kind of cue you back in to where you needed to be on the day?
Yeah, I think because of doing the course and the two sessions, I was very much trying to like lean into the cues. So I think because of that, I didn't go up too far off
Of course. Yeah.
what they were saying. There was one strange case that there's one I managed to successfully fail all domains.
Oh no.
I don't know what this patient wants from me. I know I'm not getting it. I'm probably getting annoyed, which is why I failed the relating to others domain. But I just thought I've not got this, and she's given me no information whatsoever. So
Oh,
I,
oh,
I, I don't know what happened. That was a bit of a strange one, but I guess I'll never know. But
oh
other
well, it doesn't
than
matter. But despite failing a case, you still score 94, which is a
that,
crazy, crazy high mark. And I suppose that just that does actually kind of bring us on to the fact that, with some of these cases, because they're so narrative driven, you've got to be so on point with how you pick up cues, follow the narrative. Let's talk a little bit about the clinical management, because I think one of the things that we stress on the masterclass and one-to-one is you're not really managing a symptom, you're kind of managing a situation and a patient and their emotions. What was your approach to that?
yeah, I think it was really important that you looked at what they told you in the start with their ice and looking at the
Mm,
psychosocial side of things. Because say, for example, somebody was housebound or they couldn't leave the home for whatever reason, you're trying to suggest they go for a scan or a blood test. It's not going to
yeah,
work.
yeah,
So there's no point saying that.
mm,
And it shows that you haven't maybe not been listening, or you're trying to lead them down a path that isn't going to work for them.
yes,
The whole thing with about GP is that you make it work for the patient you've got in front of you and try and come up with a solution that sort of everyone can follow rather than just
yeah.
what you think is the ideal best world scenario.
Yeah, yeah, yeah. And again, it's so strange, isn't it? Because I suppose up until this point, all the kind of clinical simulations, OSCEs we've done are very much around the diagnosis,
Mhm.
proposing what we feel is the best management, but not actually recognizing that they may not suit a patient's circumstances, their kind of
Yeah.
situation, which kind of brings us very nicely on, I suppose, to relating to others. You've already mentioned the importance of ice. How important do you think it is to actually elicit ice and elicit it early? What were your thoughts about that?
I just think it really helps you like dial into what you need to do because say you think it's going to be asking about a certain thing, but then they actually have a specific want or expectation that you just
Yeah.
to the end of your data gathering, you might need to ask more questions around it to figure out what you're going to do. And then if you don't ask it at all, you might completely miss it,
Mm.
and then you're not going to get the marks because you haven't really got to what the patient wanted. If that
Yeah.
makes sense.
Yeah, absolutely.
The
And we
only,
stress
the
that quite a lot, don't we, in
only,
terms of part of case priming is not just using the information in the notes, but actually trying to open up the patient's agenda quite early on. And also, I suppose, recognizing that sometimes you can't meet their
Mhm.
agenda. And if you know that earlier, then at least it gives you a bit more scope and time to negotiate to find the kind of middle ground.
Yeah.
I'm so happy that you passed, and actually, it's so nice to see you because we had quite a lot of fun with the one-to-ones. I have to say, I did talk to you a bit, so now that you're kind of over it, I'm glad you can see you're smiling with it. Um,
No, I
but,
was I was very nervous for those one-to-ones, but
oh,
it was because I knew I was going to get pushed, and that's what you need because
yeah,
the more you push yourself before the exam, hopefully the less stress you'll be on the day because you're used to having that sort of pressure to perform. Obviously, with you, it's different because you might you might say, "Oh, you're doing this wrong" straight
yeah,
away, rather than waiting to see what happens at the end. Obviously, not knowing how it went, but
yeah,
it's just very useful to have that bit of pressure, time
yeah,
pressure, because it just the more you can not pressurize yourself before the day and get used to
yeah.
feeling it's a bit of the adrenaline, the better
Yeah.
the day will go, I think, because you
And
know
how did the day go for you? Because we actually, with all our kind of interviews, and I've never really sort of talked with any candidate about the actual day itself. I mean, did you find that your energy was okay throughout? Because it's pretty intense to do all those stations back to back.
yeah, I think the first case threw me a bit because I think the actor was talking quite a lot and I wasn't expecting them to like
Give that much.
expecting them to
Yeah.
sort of, but then so that one went a bit, the time management went a bit off for me on the first case, and it sort of the time finished before I could say goodbye and all this.
Mm.
And then the second case started and I was like, you have to do that whole housekeeping and just try and shake it
Yeah.
off. It hurtles by very quickly. I think that was something that I was a
Mm.
bit surprised by because obviously when you're seeing patients in real life, say you had a bit of a challenging consultation, you can give yourself a couple of minutes to just regroup and
Mm. Mm.
or maybe even a few more minutes or go out, pop to the toilet, or whatever, or
Mm. Mm.
do.
Mm.
But with this, it's just okay. You've got 3 minutes. The next one's starting. You need to focus on this one straight away, and you haven't got time to think about what happened before.
Mm.
So I think the time pressure was noticeable. Like, I got
Mm.
used to it, but the first case, I thought, okay, I need to. You're not going to make any marks by just. I have to make the marks myself, if you know what I mean. Like I
Yeah,
have to,
yeah, yeah, yeah. So
because
what would you then suggest, I suppose, to our listeners to kind of mimic that pressure? Because I think what I often see in study groups is we don't necessarily apply the same type of pressure which
yeah.
people experience on the day. If you had to have a closing tip for study groups, what would you say that might be?
I think if you're going to be the patient in the scenario, just be a difficult patient.
Yeah.
Obviously, just push them, ramble a little bit, be not the most specific, and I guess just push back because the harder the cases are when you're practicing, when it comes to the actual day, you might find it goes better and they're a bit more because they generally are a bit more sort of compliant and
Mm.
willing to listen to what you say. Then, but if you can practice the challenging ones more, when you're practicing for the day. I think it just means that you go in with a bit more confidence and
Yeah, no, I agree,
nice to see.
and that's always been, I suppose, the ethos of our masterclass and the one-to-ones, which is, tough love is tough love all the same, but we're trying to push you to that kind of higher end, and obviously
Yeah,
that score is very, very reflect. I always knew you were going to pass, but that was an amazing score, I have to say. It was really stonking. So well done. I'm really, really happy and very proud for you. Actually,
thank
it was
you.
brilliant. What's the plan? Because obviously you aren't CCTing until some time. So you've got all this time now. What are you be doing with your life now from here on in as an ST3?
I don't know. I keep thinking I'm going to have to start preparing for the SCA again. Just in, oh, no, I don't. Like, there's always that next hurdle, and this one's gone. I wasn't sure about doing it in November. I thought, is it a bit soon?
Yeah,
But I
I
thought
remember. Yeah, yeah,
I can if I put in a lot of work and I had a good study group, and then obviously your support as well. I thought I'll just give it a good shot, and I know that I couldn't have done any more like for it, so I'm just
yeah,
relieved that it paid off in the end. But
yeah. It
it's
definitely.
nice. Yeah, I just need to get through the rest of the training and the portfolio, and
That's all right. That's
yeah,
fine. That's fine.
it's
It's not
fine.
as tough as
That's in
the
my
SK. So,
control.
what's your plan, CCT? Because obviously the world is your oyster now, and you can kind of sit back and I mean, 2025 is going to be a very nice year. Nothing in terms
Yeah.
of summative assessments per se, AKT, SEA all out the way. What do you think you're going to do?
I'm not sure. I think maybe take a month or so off just if I can after CCT just to maybe go on holiday and just take a minute to regroup. But
Yeah.
maybe line something up, a few days salaried, and then try and find a little second interest. I'm trying to decide what I want to do as a sort of sideline because alongside the normal clinical work, just to give myself a bit of diversity in the
Absolutely. You've got, that's what I always say to my trainees is, you don't feel obliged to kind of jump into anything. That's the great thing about GP is you can take your time with it and enjoy it. This is
yeah.
where it really, really starts. Joe, thank you so much for coming on today. I know you weren't very well with the flu, so thank you so much for joining us.
Always geeky.
And yeah, absolutely, yeah. And I'm wishing you the best Christmas and a fantastic 2025. And please keep in touch post CCT. Thank you so much.
Thank you, and thanks for all your support and everything. And have a good Christmas.
You too. Take care. Take care.
Bye bye.